Hello and welcome back to my channel. Today we're going to discuss a popular and somewhat controversial topic, the ketogenic diet and its effects on diabetes. The ketogenic diet, or keto for short, has gained significant attention for its potential benefits in weight loss and metabolic health. But what about its effects on diabetes? Is it a good option for people looking to manage their blood sugar levels or go off medications? In this video, we're going to break down what the keto diet is, how it affects diabetes, the potential benefits, risks, and important factors to consider if you're thinking about trying it. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's start with the basics. What exactly is the ketogenic diet? The ketogenic diet is a low-carbohydrate, high-fat eating plan. It drastically reduces carbohydrate intake, typically to fewer than 50 grams a day, and replaces it with fats. This shift in macronutrients puts the body into a metabolic state called ketosis, where instead of using glucose for energy, the body burns fat. Fat is converted into molecules called ketones, which then become the primary energy source for the body and brain. If you would like more information on the ketogenic diet, see my video. In a typical diet, carbohydrates are the main source of energy. When you eat carbs, your body breaks them down into glucose, which raises your blood sugar. In response, your pancreas produces insulin to help your cells absorb the glucose and use it for energy. However, in people with diabetes, particularly type 2 diabetes, the body either doesn't produce enough insulin or becomes resistant to it, leading to elevated blood sugar levels. This is where the ketogenic diet comes in. Since it minimizes carbohydrate intake, it significantly reduces the amount of glucose entering your bloodstream, which in turn reduces the need for insulin. Without the usual spikes in blood sugar from carbs, many people with diabetes notice improved blood sugar control while on the keto diet. In fact, research has shown that following a low-carb, high-fat diet can lead to significant reductions in blood sugar levels and, in some cases, allow people with type 2 diabetes to reduce or even discontinue their diabetes medications. So how does this happen? By cutting down on carbs, the body's insulin demand decreases, which improves insulin sensitivity. This means that when carbs are consumed, the body is better able to process them without causing large spikes in blood sugar. Some studies have shown that people with type 2 diabetes who follow a ketogenic diet can see improvements in their A1C levels, which is a measure of blood sugar control over the past 2 to 3 months. This is a significant marker of diabetes management, and lowering the A1C can help reduce the risk of diabetes-related complications such as heart disease, nerve damage, and kidney issues. Another potential benefit of the keto diet for people with diabetes is weight loss. Obesity is a major risk factor for type 2 diabetes, and losing excess weight can significantly improve blood sugar control. The ketogenic diet's emphasis on fats and proteins tends to be more satiating than a typical high-carb diet, meaning people often feel fuller for longer periods and consume fewer calories overall. This can result in steady weight loss, which is beneficial for improving insulin sensitivity and reducing the overall burden on the pancreas. While these benefits may sound promising, it's important to understand that the ketogenic diet is not a one-size-fits-all solution, and there are risks and challenges that come with it, particularly for people with diabetes. One of the primary concerns is the risk of hypoglycemia, or low blood sugar. When you drastically reduce your carbohydrate intake and your blood sugar drops, it can increase the risk of hypoglycemia, especially for those who are taking medications like insulin or sulfonylureas, which are designed to lower blood sugar. If you're on these types of medications, following a ketogenic diet could result in dangerously low blood sugar levels. Symptoms of hypoglycemia include dizziness, confusion, sweating, shaking, and in severe cases, loss of consciousness or seizures. This is why it's absolutely essential for people with diabetes, particularly those on medication, to work closely with their doctor if they're considering the ketogenic diet. Adjustments to medication and regular blood sugar monitoring are often necessary to avoid complications. Another potential downside is that the ketogenic diet can be quite restrictive. Because it limits carbohydrate intake so drastically, many healthy foods like fruits, whole grains, and legumes are off the table. These foods are not only sources of essential nutrients, but also provide fiber, which plays an important role in digestion and heart health. A lack of fiber can lead to digestive issues like constipation, which is a common complaint among those following a ketogenic diet. In addition, a diet high in saturated fats from sources like butter, cheese, and red meat may raise cholesterol levels and increase the risk of heart disease in some individuals, which is a particular concern for people with diabetes who already have an elevated risk of cardiovascular issues. It's also worth noting that the ketogenic diet can lead to nutrient deficiencies if not carefully planned. Vitamins and minerals found in carbohydrate-rich foods such as vitamin C, potassium, and magnesium may be lacking on a keto diet, so it's important to incorporate nutrient-dense, low-carb vegetables like spinach, kale, and broccoli to help make up for these gaps. Some people may also need to consider taking supplements. Another challenge is that the ketogenic diet can be difficult to stick to in the long term. It requires significant lifestyle changes, and because it restricts many types of foods, it can be socially isolating or hard to maintain in certain situations, like dining out or traveling. Sustainability is a key factor in any successful dietary change, and for many people, maintaining a very low-carb diet indefinitely can be challenging. If you find that the keto diet is too difficult to stick to, it may not be the best option for managing your diabetes in the long term. So is the ketogenic diet a good choice for managing diabetes? It can be, but it's not for everyone. The keto diet has shown potential benefits for improving blood sugar control, reducing insulin resistance, and promoting weight loss, all of which are important factors in managing type 2 diabetes. However, there are also risks, particularly on those on blood sugar lowering medications, and the long-term health effects of the diet are still not fully understood. As with any significant dietary change, it's essential to approach the keto diet with caution, especially if you have diabetes. Always consult with your doctor before making any changes to your diet or medication, and be sure to monitor your blood sugar closely if you decide to try it. So, the ketogenic diet can be a tool for improving blood sugar control and promoting weight loss for people with type 2 diabetes, but it comes with risks and challenges that shouldn't be overlooked. It's important to weigh the potential benefits against the drawbacks and to make an informed decision in collaboration with your healthcare team. Ultimately, the best diet for managing diabetes is one that is sustainable, nutritionally balanced, and fits your individual health needs and lifestyle. Thank you for watching. I hope this video has provided some clarity on how the ketogenic diet affects diabetes. If you have any questions or would like to share your experiences with the keto diet, feel free to leave a comment below. Don't forget to like this video and subscribe to the channel for more health-related information. As always, take care of yourself and make the most of your day.